My name is Tim Baltus. Welcome to the 2016 Open Enrollment Meetings. Keep in mind we are being recorded this time, and so what we're going to ask you to do is when you have questions later to raise your hand. We'll get a mic to you and try to get you loud and clear so everybody else can hear you. The point of this session today is obviously for you to know more about your benefits. You can talk to Stacy and myself anytime, and we do the best we can to mimic the subject matter experts, but today you actually have those SMEs in the back, and so you're going to hear from most of those today. And at the end, I encourage you to go ahead and talk and visit with them, to ask them about any specific questions you may have. We each have unique situations. You may not want to share it with the group. I understand that. This is recorded at the same time. It's an opportunity for you to learn more about the benefits. So please feel free to raise your hand. We will go ahead and find you, give you a mic, and we'll go ahead and get through this. Good news. So our plans are virtually identical from last year. And the good news is the cost is virtually identical as well. There's very, very small changes that they'll go through throughout the presentation. Prescription drugs, we have a new vendor. We'll talk about that. We have a $5 difference between your payments and copay plan. And we'll talk about that as well. But besides that, it's pretty much the same. And I'm excited about that because if you talk to your friends at other organizations, rates are going up to 15, 20%, and ours have stayed virtually the same. So I'm excited about that. I want to spend special thanks to the Large Insurance Committee. Their role is to go ahead and vet out what people like myself and Stacy and Rob and Marla and those kind of look through and decide. And so I want a special thanks to the Large Committee. As well, I want to spell a special thanks to Rob Rector, who does a lot in this avenue. Long before I came here, he's been kind of the insurance man, and so he's worked hard through this. Also, Marla Moody's had her hands in it. Janine O'Carroll, a lot of other folks have put a lot of effort into this. Especially one last thanks to Stacy Burton, who's really went above and beyond and really put this in her wings and made sure that this has been effective and a really good plan going forward. And so I want to send a special thanks to Stacy. With that being said, MedPlay also is our broker, and they've been with us for 2 years, and they've done an outstanding job helping steer us in the right direction. And so I want to go ahead and introduce Gordon Kinney. He's the president of that organization. He knows a lot about everything and a lot about everyone. And so keep him close to you. But no, he's a good guy. Let's give a round of applause to Gordon Kinney, please.
Oh, Tim. Good morning. Thanks for coming. We're going to run through this. We'll keep you here about an hour, maybe a little bit more. We do have several vendors here on the coverage. We've got Aflac back there, Cigna, who will make a presentation, Cox Health. Also, I'll mention Jim Godown with Insurance Group of the Ozarks is back there. For those of you that may be contemplating retirement or have a spouse that's looking at Medicare age, we had a couple people that might be retiring later in the year, like in June, that can help you. And also, as Tim will probably reference again, sometimes you can go buy coverage for children or even your spouse or both on the outside from the group plan, and there's individual markets available, and Jim's the expert that we use to outsource that information. So now I'd like to introduce, oh, she's already up here. Maylene Smith, those of you that were here last year, she's with Cox Health Plans. She's going to go through the Cox piece of everything. So everything she's dealing with is going to be on the left-hand side of your packet that you have. Okay? So here's Maylene.
Thank you. Bear with me. I'm trying to keep my voice while we do these today. What I'm going to do for you this morning is go over some of the core pieces of your benefit plans, go into the changes that Tim was talking about, and then also talk about a few other important pieces of information that we think is definitely important for you to remember as you go through the year, particularly regarding your network and preventive services, but also a couple of new announcements as well. Okay, so with that, traditionally you've had the copay plan, the basic plan, and an HSA, or high deductible health plan. So as you can see, we've still got that scenario up here. On the copay plan, your one change is that the office visit copay for primary care physicians and specialists is going to $50. Okay, that's per visit. And then for both the copay and the basic plan, everything else will stay the same. Now on the high deductible health plan, or HSA, OTC is going to increase their contributions to the HSA account for you. That's going up to $83 a month if you're on that plan or if you are considering going with that plan. And then the benefits themselves, as you can see, the deductible and the out-of-pocket and all of that stays the same. But one thing that we need to go over with you is that there was guidance or regulatory information passed down in February related to these types of plans, basically saying that the out-of-pocket had to be considered embedded. So what I'm going to do is explain to you embedded versus non-embedded, and then I'll give you an example. So your current PPO plan, so the copay plan and the basic plan, both have what we call embedded deductibles and embedded out-of-pockets. What that means is that one person, whether you have one person on the plan or you have family coverage, dependents, spouses, etc., one person does not have to ever meet more than the single deductible and the single out-of-pocket. So once you hit your maximum, then you would begin receiving 100% coverage for the rest of that year, as long as you stayed in network for your care. So that's how those two plans work and have worked all this time. The high deductible health plan has previously been what we call non-embedded. And what that means is that if you have dependent coverage on the plan, whether it's just your spouse, one child, or full family, the family deductible has to be met first before any coinsurance benefit applies to any one person. So what could happen is you could have one person on the plan who's incurring all of the claims, right? But they've got to hit that family deductible on their own. And then the same would hold true for the out-of-pocket. What that guideline said in February is that starting this year, or next year, sorry, we have to change that to where any one person could have to meet the family deductible, but once the family deductible has been met, no one person is required to meet more than the single out-of-pocket. So they've effectively kind of reduced what your exposure could be under that plan in a family scenario. So if you look up here, the individual out-of-pocket, and this all this on this page includes the deductible and the out-of-pocket. Those are added for you. So on the HSA plan, it shows for the individual out-of-pocket, it's $4,600. So that's that $1,300 plus an additional $3,300 out-of-pocket. If you're on the family plan and basically you've got $9,200, so that's 2 times the deductible and 2 times the out-of-pocket. Okay? If you are one person under a family plan, you would have to meet potentially the $2,600 plus the other $33,000, which is $59,000. So one individual wouldn't have to meet more than $5,900 under family coverage for the HSA. The total, grand total family is still that $9,200. So as an example, if you have, let's say, a $5,000 charge, let's say it's an inpatient procedure or something, then on single coverage, of course, you know, you would pay the $1,300 deductible, and then you would pay 20% up until you had hit that total $4,600. Under a family for this plan, remember what I said, you have to meet the family deductible first. Let's say nobody else had in the family had any claims yet that year. That $5,000 charge, you would have to apply the $2,600 deductible and then 20% up to the other $3,300. Okay? I know it's kind of confusing. It's hard to figure out the best way to explain this. If anybody has additional questions about this, I'm happy to talk to them about it at the table afterwards, but hopefully that's gained a little bit of clarity for you. And then on the prescription drug benefits, just remember that for the high deductible health plan, you're paying the discounted retail cost of that medication, but it does apply to that medical deductible, whereas on the other plans, you have the copays. Okay? Okay, just some reminders on other points of the plans. Your office visit copay for the copay plan, that covers your consultation fee. So if they do any diagnostic testing, x-rays, lab work, those items will be covered. They just apply to your deductible. On the deductibles, they do accumulate on a calendar year basis, so the January through December. And then unless the service that you're having done has a copay attached to it, then you've always got to meet your deductible first before the insurance company will start to share in any of the costs with you. Same for the out-of-pocket maximum, that also accumulates on a calendar year basis. And then just to point out that prior slide, I mentioned to you that the out-of-pocket totals include the deductibles. So the addition has been done for you on that particular spreadsheet. If you look at the Cox Health Plan's benefit summaries, the addition has not been done for you. So we actually separate the deductible and the out-of-pocket. So if you add the two together on your benefit summary, you'll get the same totals that you do on the grid that was on the prior slide. Just remember that, and this started last year, all of your medical copays, prescription deductibles, and prescription copays do apply to your total maximum out of pocket. That was a change that started last year. And then just a reminder that if you choose to go out of network for your care, just note on the far right-hand side of your benefit summaries that will show you what your out-of-pocket expenses could potentially be, because it is significantly higher. Okay, I was asked to touch additionally this time on brand name versus generic medications. We kind of all have our particular feelings about one versus the other, but I'm going to go over some facts with you. So essentially, generic medications have at least 85% of the same ingredients that brand name medications have. So in general, majority of people are going to have the same benefits from a generic versus a brand name medication. Now I know that that's not going to be the case all of the time. There are going to be some people who either don't have as much benefit from the generic, or maybe there are certain contents in the generic that doesn't settle well with them, and that's fine. But we just want to be cognizant of using the generic when you can, because that does affect the bottom line. So you all don't generally see the differences in the actual costs between the two categories of medications, and sometimes it can be pretty astronomical. And the reason to be a good steward of that when you can is that that does affect the bottom line of the cost for your insurance, therefore how much the benefits cost you, and then also the type of benefits that OTC is able to offer you as well. Now, if you weren't aware of this, and maybe you haven't because you haven't had this scenario, your plan has had for several years now what we call a mandatory generic provision. All of our plans have this, and it is to help with that cost control mechanism. Basically what happens is when you go to the pharmacy to fill a medication, if there is a generic equivalent for that medication, that is what will be filled for you. Unless the physician has written on their dispense as written, or unless they put that on there and you request that, you get the brand name medication. It is totally, of course, your prerogative to purchase that brand name med. What happens is if you do elect to take the brand name medication for whatever the reason might be, you would pay the brand name copay plus the difference in the cost between the two medications, the generic versus the brand. Okay? So that's just more of a reminder and an FYI of how that particular benefit works. And then lastly, for prescriptions, if you do have the HSA plan or you're considering taking that plan this time, but maybe the prescription side of it makes you a little nervous because you're not paying a copay anymore. You're paying whatever that discounted retail cost is. This is where you get a chance to shop. You can actually price how much pharmacies will charge for that medication and select the cheaper alternative versus maybe the pharmacy that you're using now. And you can either do that online or there is a mobile app for the pharmacy company that you can use to do that shopping. Okay, now we're going to get into some key reminders about HSAs in general. And I told the last group, these are the same slides as last year. I literally made one change and it's in red. So that information should be somewhat familiar to you. Who's eligible for the account? Well, first of all, you have to be enrolled in the high deductible health plan. You cannot be enrolled in Medicare. You cannot be claimed as a dependent on someone else's tax return. And you must be able to qualify for a Great Southern savings account. Great Southern is the financial institution that houses the HSAs for OTC. Okay? Now the top three are IRS rules. All of this is guidance from the IRS. The bank account portion, that's a requirement for Great Southern. Can I add money to an HSA? As long as you're enrolled on the high deductible health plan, yes, you can. The limits for contribution next year are the same as they were this year, except the family amount has gone up by $100. How can I use that money? IRS defines a certain list of what they call qualified medical expenses, and those are the items that they deem as appropriate for you to use this money for covering. Now, you can obviously spend that money as you choose, but if you choose to spend it on something that's not a qualified medical expense, you'll be taxed pretty heavily at 20%. Okay, and can I use it long term? Basically, yes, as long as you have money in that account, you can continue to use that money to pay for your qualified medical expenses. The key thing is if you drop off of a qualified high deductible health plan, you just can't contribute to the account anymore. So people worrying about, well, what if I go on there, I don't really like it, and then I've got money left over. I've lost that money, and that's not the case. You can continue to spend it until the money is gone. Okay? And then the most common question, can I contribute to both a flex account and a health savings account? And that is a no. Under your cafeteria plan, you cannot do both. So if you would prefer to do the flex plan, you've got to pick either the copay or the basic plan. And then if you pick the HSA plan, just do so knowing that you can't do the flex anymore. Okay, and these are just some links. All I did was Google, you could do it, the same thing yourself. But these are just links to the IRS rules for HSAs where you can get the list of the qualified medical expenses. Okay, the next section, just reminding you on the preventive care. You do have quite a few services available to you at no cost under the Affordable Care Act. So for going on 5 years now, we have provided our clients with a preventive services list that shows you all of the ones that are available at no cost under this law. Now, as I've told you previously, There are preventive services that you can have done that aren't necessarily part of the Affordable Care Act list. So if you happen to have that done, they're going to still be covered under the plan. It's just going to pay like any other benefit. It won't be at no cost to you. Okay? How these are covered are completely driven by the codes that the physicians file with us. So if they are filing preventive codes, then that will be part of what helps you maintain that $0 benefit or $0 requirement. If they file it with us with a diagnostic claim, so in other words, you had an issue, you had an ailment, etc., then that is what can kind of trump that benefit sometimes. So when you go in for your annual visit, just try to remember to let your physician know that you're just there for your annual, whatever it may be. And the other thing with respect to codes, for all this time, we've been listing the respective codes on that sheet that we provided to everybody. Just to help you when you go into your doctor's office, you could give it to your doctor and say, you know, whatever's on here, these are the ones I want to use. And the physicians have the same list, and they would file as such. We've had to take the codes off. Just FYI, the next time you see that list, and there should be one in your packet, because there was a recent national conversion from what they call ICD-9 codes to ICD-10 codes, and that shouldn't mean anything to you other than there's been a change. And what that means is that physicians now have like tens of thousands of more codes that they can use to more appropriately identify the service that they provided to you when they're sending us the claim. So that's good for a lot of research and things like that, but literally tens of thousands of codes were added, so that made it prohibitive of putting that on a one-page sheet anymore. So we've taken the codes off, but we'll continue to provide you with the listing of the services themselves and the requirements that go with them. Okay, the provider network is not changing, so I mean, obviously, if you're in our 26 county area, you want to make sure that you're using Cox providers and facilities to access your in-network claims. When you're outside of our 26 counties, you would still be using First Health for your extended network. So that's going to be your Mayo Clinics, Barnes-Jewish, MD Anderson, WashU, Columbia. And again, that information will always be on your ID card. You'll always see their logo with ours, and their information is also on the back. Okay, wanted to announce a new service that will be available to you starting January the 1st, and we'll have more information that we'll provide to HR in the weeks to come. We're calling them telemedicine services. They're certainly not new to the industry, but more new to the area. Cox Health is going to be providing this service for our clients, and this is going to be under their basic care plan. So they can offer a lot of telemedicine type services, but this is relating to actual health care. So for your more simple type needs, you've always had either Dr. Blaine, which is great. You've had access to e-visits with us, which is what I used to call kind of emailing securely with your physician. I call this Skyping with your physician, because you're actually going to be able to see them on the screen. It won't necessarily be your specific physician, but it will be a Cox Health physician. You can use smart devices, so smartphones, iPads, things like that, your laptop, home computer, and it's a pretty nifty thing just to help keep you from having to take time off work. And again, if Dr. Blaine, I know he's got certain office hours and things like this. This service is available from 7 a.m. to 10 p.m. Monday through Friday. On the copay plan, it would take a $10 copay, And on the basic plan and the high deductible health plan, it would take a $45 charge. Okay. One other nice thing is there's a lot of telemedicine services out there that are administered by third parties. And while that's good, what doesn't happen in those instances is that what care you get over the phone or whatever is not registered in your Cox Health medical records. These will be, because it's being provided by Cox Health. So your primary care physician will have access to what was done, what was prescribed, etc. So look for more information on that to come. And then lastly, Tim kind of mentioned it at the beginning, we are changing who is providing the pharmacy benefits to you effective January the 1st. So it will no longer be Catamaran, it will be Envision RX. So what to expect, you will get a welcome packet from Envision RX in December. So please keep an eye out for that information. It will have a lot of information in there that will be important to you. A couple key points to note, just so you know, we're trying to make this transition as smooth as possible for everyone. So all current prior authorizations, if you've gone through step therapy, etc., any red tape that you've had to go through to get coverage for a medication under the prescription plan, that will carry over, that will be grandfathered with Envision. If you currently have mail order that you're signed up for your prescriptions, that will just get transferred automatically. You won't have to do anything to the Orchard mail order pharmacy, which is what Envision uses. If you have any new prescriptions that come up, you will have to set those up with Envision just like you would have with Catamaran. You will get new ID cards. Everyone who is covered under the plan, so that's employees, spouses, children, just like now, everybody's got their own card. Everybody will get new ID cards because the prescription information is on there, so we've got to change all of that out. Okay, so make sure that your addresses, your home addresses, or PO boxes or whatever you use are current and up to date in Stacy's system to make sure that you get those. Those will come in December as well. And then the first time that you go to the pharmacy in 2016, because this information has changed, you'll want to make sure that you show that new card at the pharmacy so that they file it with the proper place. Okay. Now I skipped over the middle there. CVS pharmacies I want to touch on. That will be the one outlier on the network of pharmacies. That will not be part of the network starting in January. So we don't make those kinds of decisions lightly. We do look at disruption and savings and what's worth it. And so when we did the review, there was, for what was being used, there could be significant savings, but very little impact overall. Out of about 46,000 people, about 700 had gone to CVS last year, and some of them it was only one time for like an antibiotic or something. And out of your group of people, OTC, 19 people had used it. So we felt like that was an appropriate switch to make for the savings that it could come back, because those savings do get passed down to our clients. So just point to note on that. And then if you have any questions, I will turn it back over to Gordon.
If you refer back to the very first sheet that we had up, that's the summary of the plans and all that, I just kind of wanted to, and we won't bother to put it back up there because I don't know how, but there's a lot of thought that goes into the benefit offering that you have, because it's a diverse workforce at OTC, and so there are plans that hopefully fit you. 2 of the plans cost you nothing as an employee. The only one that has a contribution is the copay plan, and this year the change was it went from $40 to $50, and it is, the $50 just applies to the doctor's actual charge. So if something is done, a test or a shot, or that's not covered under the ACA 100% stuff, that will go to your deductible. In addition, I just want to highlight on the health savings account, while there is no cost for you, the employee, there is no cost to you as the employee. There's also a contribution that goes into your health savings account if you set one up of $83 per month, and that's $996 for anybody that's good math out there, that you can use throughout the year. It has to be accumulated. So it's a pretty good thing to look at too. For those of you that don't have big claims, you don't have much usage, you're trying to cover something more catastrophic. And the money goes into the health savings account. It's yours to keep. You know, it really is. Now we're going to move, any questions on that? Okay, everybody's shy this morning. We're going to move to the right-hand side of the packet, and we're going to deal with the life insurance and coverages like that. And Scarlett's here from Cigna, drove in from up north, and she's going to go over these benefits with you. They're virtually like they were last year, but some of you may be new, so that's why we're doing it.
Thank you, Gordon. Well, good morning, everybody. Thank you so much for joining us today. This is a big crowd, much bigger than 7:30 this morning. So not going to spend a lot of time on this, but what we're going to talk about is your life insurance, your long-term disability, your voluntary life insurance, and then your dental and vision services that you have through Cigna. So first of all, on your basic long-term life insurance, if you're an employee that works 40 hours a week or more, then you are eligible for coverage, and your employer does pay for this benefit. And you have, your benefit amount is 1 times your annual salary, up to a maximum of $100,000. You also have accidental death and dismemberment with that coverage as well. And then you have long-term disability. And long-term disability is basically income replacement from when you are off work or when you're unable to work. And the monthly benefit, this is a monthly benefit, so you have covered earnings up to $6,000 a month, and it's 66.67% of your earnings. There is definitions of disability that you'll need to look at, and then there is what we call an elimination period. And that's basically a waiting time for when your long-term disability benefits take effect. And that is an elimination period of 180 days. So you must be disabled 180 days before the long-term disability goes into effect. You also have voluntary life insurance through OTC, and this is something that is paid for by you. It's voluntary. And when you're in, at this time, you can increase your voluntary benefit by $10,000, and that goes into effect on January 1st if you elect to do that. You also have coverage for your spouse, and their increments are in $5,000 increments. And you also have coverage for your unmarried dependent children as well, and that's a benefit amount of $10,000 in units. Does anybody have any questions on the long-term disability, life insurance, or the voluntary life insurance? Okay, so next we're going to talk about your dental plan. And you guys have been on dental for a year now. If anybody enrolled last year, you've been on the plan about a year now. And you have a fantastic benefit plan through Cigna and through OTC. Your employer provides you a great benefit plan for dental. You have what we call a progressive schedule. And what that means is, during 2015, if you went and received a preventive visit, then your benefit maximum increases this coming year by $250. And that increase applies to each person in your family that received a preventive visit. Does anybody have any questions on that? As long as you get a preventive visit this next year, then your benefit increase will be another $250 for the following year. Now, if for some reason throughout this year you decide not to get a preventive visit, then your benefit maximum stays at the level it currently is. Okay? Not a lot of employers provide that benefit, but it is a great benefit, and it gives you that incentive to get your preventive care. Another incentive is that it's covered at 100%. So your plan, again, fantastic. You have no deductible. Very, very rarely do I see a plan that has no deductible. So again, for your class 1 expenses, those are your preventive, your basic services, or your diagnostic care, it's 100% no deductible. And when we're looking at these benefits, we're looking at in-network benefits. You have the same benefit outside of the network, but if you go to a non-Cigna dentist, that dentist can charge you the difference in what the reasonable and customary is that Cigna would pay. So just keep that in mind. If you go to an in-network Cigna doctor, they're going to write off any balance. You're not going to be billed for that. So when we look at Class 2 services, those are things like fillings and your oral surgery. Again, 100% no deductible. So again, fantastic benefits. Root canals, brush biopsies, 100% no deductible. Then when you get down into the major benefit, those are those more expensive procedures like crowns, like bridges. Those are still generously covered at 60%. And again, no deductible. I mean, I do not have another plan that has those rich benefits, so great job, OTC. And then orthodontics is not covered under your plan. So I already kind of touched base on the preventive care. Again, very important that you get those preventive visits, those cleanings. You need to get those not only to take care of what can be detected early, but we also have a program built into the plan called our Oral Health Integration Program. And what that is if you have certain conditions like diabetes, or if you have had head and neck cancer, you can get an extra periodontal visit reimbursed to you at 100% just for being a part of Cigna. So that's a program. There's information out on the web, out on mycigna.com, on that program for you. How many of you have registered for myCigna? We've got a few. So I encourage all of you to go out and register for the website. mycigna.com has a lot of resources out there for you. You can look up your dentist. You can price out your dental procedures. So if you want to know before you go to the dentist kind of what your estimated out-of-pocket's going to be, that's a great resource for you. So I encourage you to go out and register for mycigna.com. Healthy Rewards is also a program that's available to you. Whether or not you have the ancillary coverages, the life, the voluntary life, or you just have the dental coverage, you have access to Healthy Rewards. And those are discount programs available to you, things like fitness centers, complementary and alternative medicine, vision services, hearing aids. Those are, again, available to you out on mycigna.com. How many of you have smartphones? A lot more people have smartphones than what have registered on myCigna. So again, we have a mobile app. It's the myCigna mobile app. And you can download that. There was a lady in the first meeting. She downloaded it while I was talking. Very easy to use. But this will give you access to myCigna on the go. So I encourage you to do that. You can look for dentists. You can look at your claims online. So if you get home at night and you get a bill from your dentist, don't pay that bill. First, look at myCigna and find out if what you owe is what that doctor is billing you for. Okay. You can look up your dentist online or on myCigna as well as on the mobile app. And then that shows you how you can see what those procedures might cost you. And of course, if you don't have a smartphone, if you don't have access to a computer, you can always call Cigna. We're there 24/7 to help you with any questions. Any questions on dental before we hit on vision real quick? All righty, with your vision plan, again, you have great top-notch coverage with vision. You have a $10 copayment on your eye examination, covered at 100% after that. And then you have a materials copayment of $25, and that covers your lenses, your hardware, your frames. Lenses are covered at 100% after that $25 copayment, and your contacts are covered up to $120. And then your frames as well are covered up to $120. Now, if you pick out a $500 frame, you're still going to get a discount on that additional amount out of your pocket. In the back, we have some information, lots of flyers for you. A couple flyers in particular on the ancillary benefits, your life and disability. You also have coverage for benefits like will preparation, travel policies, and then identity theft protection as well. So feel free, stop by, ask any questions that you have. We'll be around most of the day. Any questions? Thank you so much. We're excited to have you here with Cigna another year.
Thank you, Scarlett. Appreciate it. Just to kind of go over this at a higher level again, OTC provides you with your basic life, that's one-time your earnings up to $50,000. They provide you with long-term disability benefits, and they also provide you and participate in the dental coverage. The vision coverage is voluntary. You choose whether you want to participate in it or not. The dental and the vision lines did go up 6% this year from what was put in place last year. However, on the dental insurance, the college is picking up the difference in the increase, so your actual cost for dental, whether it's single or family, and Tim had referenced this earlier, is going to stay the same, but the vision will be passed on to you. So very few employers provide the level of life insurance you're getting. Usually it's a flat $10,000 amount or so, let alone doing the long-term disability and also participating in the dental. So it's a really good benefit package that they do have. Okay, any questions on any of that? Okay. I'm going to introduce Megan, that's with our staff, but first, do stop by if you have questions. And again, Jim Godown's back there if you have questions about individuals or if you're individual coverage for a dependent or things like that to help with that. And later on, you know, our AFLAC person's there, so all these folks are back there. We also brought some stuff, everybody did, and we really don't want to take it back with us. So, you know, the goodies that we always give you people. Megan Bramer is with MedPay. She's with our staff. She's also part of the OTC family. Her husband, Chip, has been here 15 years. Is that, gosh, 15 years. It's been that long. And he you know, is on staff at OTC. And she runs our Flex department plus other things. So she's going to talk about the flexible spending account. Okay?
Good afternoon, or morning still. I want to tell you a little bit about the flexible spending account and how it's a benefit for you. By doing money out of your paycheck pre-tax, it makes your paycheck go farther to pay for those things that you needed to pay for anyway, or that you could plan for. One of the buckets you could do is the unreimbursed medical FSA. You could use that to pay for any healthcare related expenses. Some examples there: medical, dental, including orthodontics, vision, prescription drugs, chiropractor services, vision services, over-the-counter supplies, and if it's over-the-counter medications, you will need a prescription on file, and mileage. And mileage isn't something we talk about a lot, but it could be important for you to help use up those dollars, or if you have to drive especially far, like to St. Louis for specialist visits. The maximum that you can do is $2,550. And again, just to reiterate, if you are on the high deductible plan, you can do the health savings account, but you cannot do the unreimbursed medical FSA account. The money that you put into this account is available to you from the first day of the plan year. So it's like taking a paycheck advance, so you could take out more than what you've put in, but you spend each month thereafter continuing to put in the contribution, so that by the end of the year, what you've put in and you take out should balance out. Yes?
Why did they lower the limit on your flexible spending account? When your out-of-pocket deductibles can total over $6,000, why are you not allowed to put that amount into your flexible spending account?
The Affordable Care Act made the change to the flexible spending account plans, and it capped the maximum that the employers could offer through the flexible spending account. So that first minimum was $2,500, but it was changed to the $2,550 January 1st of 15. So we're on the second year at the level of the $2,550. They have a projected increase over time where that's going to go up, but I won't editorialize on thoughts why for the tax savings for the government by decreasing the amount you could do pre-tax. But it just, I think, helped balance out the Affordable Care Act. With the dependent care bucket, it is set aside with each paycheck. When you put the money in, you could turn in a claim to get that money out, but it's not pre-funded like the first bucket that we talked about. This is set up so that you could take money out to pay for daycare or after-school care related expenses so you could work or go to school. You cannot use it to pay your spouse for the daycare, but you can pay a relative that would be your daycare provider. And it's assumed that they're going to be filing their tax return showing that as income. So you're getting the tax deduction on your side, but they're going to pay their taxes for the income on their side. The max you could do is $5,000 if you're married filing jointly. You could do $2,500 for each parent if you're filing separately. The Benny card is the debit card that's automatically issued to you if you do the unreimbursed medical election. It is loaded, like I said, with the full amount for your annual election. The card itself is a multi-year card. So if you've noticed the expiration date on the card that you got after January 15th election was posted, it has a 3-year expiration. So your new election will automatically be posted to the same card. If you no longer have that card, we can get a new one ordered for you. There's a $10 replacement fee that's charged by the bank that does the reissues. It is deducted from your Flex account, so it's not something you have to pay up front or debit out of your account. One of the other things about the debit cards is the fact the IRS requires substantiation. We try everything that we can to get it substantiated before we ask for a receipt. The government has set up in the regulations ways that the merchant can actually do that substantiation. So that's the first step. If that third party can substantiate it before we get it, we'll do that. And another way is copay recognition. We load all of the copays for your plans in our system. If it's a multiple of up to 5 of any of those copays, then it will match. Also, if we've asked for a receipt and we have it in the system and it's a repeat transaction for you, that's a recurring transaction like an orthodontist payment, those will then automatically substantiate. If we do need a receipt, we'll send you a notice. That's either by email or mail. If we have your email on file, that first letter will come out that way, and it will give you a 30-day period to send us in your receipts. If we still don't have them, we'll send a reminder at the beginning of the next month. At the end of that month, if we still don't have the receipt, your card will suspend. This is the IRS guideline for how the debit cards need to function. We will do everything we can to help you out. So if you get the letter and you're having trouble getting a receipt, call us. We may be able to conference in with the provider and have them give us the information over the phone. Sometimes they need your approval to release the information to us. So if you call, we could do that call together. And another way is if you are when you're saving all of your receipts, if you try to have one place you put everything you use your Flex debit card for, keep them all together, then you should have that handy if we need to get the receipts. You could send it in. When you get that letter, use it as your cover sheet. It's got the date of service, the merchant swipe date, and the dollar amount on there.
How long are we expected to hold on to these receipts?
As an individual, I can't remember if it's a 3-year time period. It may be a little bit longer than that. But whatever you would normally save your tax records, you just keep a folder to put these receipts in with it. Okay. Just some important dates and reminders for you. The enrollment process must be completed for your Flex election. It does not automatically re-enroll each year. You must incur the expense during the 2015 year to use up the money you still have in the account. When you make your election for 2016, then what you elect next year must pay for the 2016 incurred expenses. So you can't cross years. If you incur it this year and you're on a payment plan with the hospital, you cannot use next year's money to pay for this year's expense. All of your claims must be filed by March 31st. If you do terminate employment or retire, you've got up until that date to incur your expense. You have 90 days from that date to get everything filed. When you make your election into the Flex plan, it is set for that full year. There are a few situations where you're allowed to make the change. If you have a life-changing event that's a recognized event under cafeteria plan rules, just go in and talk with Stacy and she can help you out. If it's dependent care related, that has a little bit more flexibility. If you change daycare providers or the cost changes, then we can help you get that changed in most cases. And again, the dollar amounts are listed there at the bottom. Our contact information is in your packet. The benefit portal, employee portal listed here in the middle, that is where you go to look at your account 24/7. You can see your claim status, you can file a claim, you can scan and upload the information to do that, and also for substantiation if you've received that letter. And that's it. Question?
Yes, is there an app where you can submit photos of your receipts?
At this time, we don't have the app to do that, but you can still do it that way. You just attach it to an email.
Okay, all right, thanks.
Okay, and with that, it's the email that's in your packet, the flexclaims@med-pay.com, or flexcs for Flex Customer Service. Either way.
Can you use the FSA for people that are not on your health insurance?
Yes, as long as they're like part of your household or a taxable dependent, then you can cover any of their claims. So if you have a family, everybody has allergies, or you've got a lot of Tylenol, ibuprofen, or even their medical plan copays or dental services, they do not have to be on this medical plan to have their benefits repaid to you out of your Flex. I'll be around after the session today. If you have any questions, just stop by. Thank you.
Thank you, Megan. Okay, our next presenter is Aflac, and 2 points I want to make on this. Number one is each organization has a different approach towards short-term disability. The way this organization has attacked that is our generous sick leave accrual. So if you've been here for a couple years and you ever go to your sick leave bank, you'll notice it gets big fairly quickly. Unfortunately, those of you who are newer, 1 or 2 years, or you've had some issues and you've been out quite a bit, you may have a small accrual or a small amount. So the way short-term disability works is that after a point in time, after you miss out on work, they actually pay back some of that income that you're missing. And so it protects you from those days, those weeks, those months where you may be in what we call no pay status. So once again, if you're an individual who is newer, this is definitely important to you. If you're someone who's been here for a while and you still want extra protection, or you don't have a lot of sick bank time, if you will, it's an opportunity for you to protect yourself. It's something that we added last year because we looked at this and found this gap in our coverage, if you will. Also, they have a different change with one of their policies where it's actually an extra like $1 or so a month, but the coverage is a lot better. And so Dave's going to go over that with you right now. So Dave Childs from Aflac, he'll go ahead and take you through this presentation.
Well, good morning. I'll be your last presenter. How about that? Basically, what Aflac is, it's just voluntary insurance, totally separate from health insurance, where health insurance pays doctors and hospitals, Aflac pays you directly, and you can use that money for anything your little heart desires. What Aflac was designed for is to help with out-of-pocket expenses associated with injury or illness. You can grab the little clicker. There was a study by Harvard back in 2005. Nearly half of all Americans who file bankruptcy do it for medical reasons. It's just a stat. That is a great need for Aflac. What it does is it's going to pay for the little things that health insurance doesn't, whether it be your electric bill, house payment, car payment. Doesn't matter. You can throw a party. We'll never ask what you use that money for. 3 major benefits. It's guaranteed renewable, so every year it automatically renews. There are no renewals on that. Rate stable. Once you take out a policy with Aflac, the rate locks in for life. We will never change your rate. So even if you leave the organization, you can take it with you at the exact same rate. That's the benefit of coming through OTC. You get a group rate, which saves you about 40% rather than buying it from me off the street. So, and you can take it with you, like I said. It's really, really easy. Most popular policy is the accident policy. A lot of you guys have the accident policy. What it does is it's going to pay you lump sums of money for everything associated with an injury. Could be something as minor as poison ivy to stitches, sprained ankles, broken bones, major car accident, and everything in between. For those of you with, families, like I have 2 daughters, both of them play soccer and softball. They're crazy people. I had 4 claims within 5 weeks last year. Had a broken arm, snapped wrist, stitches in the chin. My daughter's a catcher, obviously takes a lot of shots with that. I tore my rotator cuff. It's just the little oopses in life, you know, and it pays for stupid. Let me tell you. Basically, it's 24-hour-a-day coverage, on or off the job, does not matter. Even if workman's comp's paying, we're going to pay you because it's totally separate. We don't care who's paying behind the scenes. We're going to pay directly to you. Pays for everything associated with your injury. Does have a wellness benefit of $60. Once you've been in the plan for a year, you go have your eyes examined, teeth cleaned, physical. We're going to pay you $60 back one time per year, just as a little thank you. I do like to clarify because even my wife got this wrong. She went and had her eyes examined, teeth cleaned, and did her well woman. Thought she was getting $180. Doesn't work that way. It's $60 one time per year. So I do like to clarify that. It does come standard with accidental death life insurance. So if nothing else, it is pretty cheap life insurance. Cancer, obviously, everybody in this room has probably been affected by cancer at some shape or form. This will give you the financial means to seek the best medical attention and not have to worry about your finances. Cancer is a financially devastating disease. You know, we saw the stat back there on the bankruptcy. Number one medical reason for bankruptcy is cancer. You know, what this policy does is it's going to pay you a lump sum just for being diagnosed, and then it will pay for things associated with your journey, whether it be chemos, radiation, hospitalization. Two major components are transportation and lodging. If you want to seek treatment, you know, down in MD Anderson in Texas, please feel free, go ahead. We'll give you the financial means to do that. If you're not well enough to get come home, there's a lodging benefit. Go ahead, get a hotel room. Two major benefits of this policy that most health insurance carriers don't like to pay for are experimental treatment. If you want to go eat tree bark in the state of California, we'll help give you the financial means to do it. Experimental treatment we pay for. The other thing is reconstruction. My mom and grandmother both had single mastectomies, and their insurance considered it cosmetic. We don't care. You do what you need to do. Wigs, obviously I'm bald. I couldn't care less. My wife, on the other hand, might want a wig. We do pay for stuff like that. Major benefit of the cancer policy, kids are free up to the age of 26. Does not matter if they live at home, full-time student, or even married. They can stay on to the day they turn 26. Once again, does come standard with a $75 wellness benefit, so if you go have a cancer screening, they will pay everybody $75 for that, even though it's covered at 100% for most health insurances. Short-term disability, basically you're buying your paycheck in the unfortunate event that you're hurt or ill, cannot work. This is great for maternity. Young ladies who are wanting to add kiddos to the mix, maternity is considered an illness. Darndest thing, I don't make the rules, I just adhere to the rules. There is pre-existing on this particular policy. It's guarantee issue, so there's absolutely no health questions. But for pre-existing conditions, there's a 12-month rule. So if I blew my left knee out last year, they wouldn't cover my left knee for the first 12 months. The rest of my body, yep, but my left knee, no. When it comes to maternity, it's a little bit different. You can't deliver within the first 10 months of owning the policy. So basically, you can't be pregnant when you sign up. That's the catch. Okay? Hospital Advantage, basically, it's my little deductible buster. If you are hospitalized for any reason whatsoever, there are lump sum payouts just for being admitted, physician visits, ER visits, short stays, rehab, all kinds of things associated with that policy. It's a great policy, like I said, to offset your deductible. And that is for any reason, injury or illness. Last one I'll tell you about real quick is the critical illness. Covers heart attack, stroke, coma, paralysis, major organ transplant, end-stage kidney failure, stuff of serious nature. You choose a dollar amount ranging from $5,000 to $50,000 worth of coverage. In the unfortunate event that you incur one of those illnesses, they'll pay you that money up front. That way you go seek the best medical attention, not have to worry about finances. Okay? That one does have a $50 wellness benefit as well. One thing I would like to point out, as Tim did, the accident policy, if you currently have the accident policy, we are switching that policy to a new Aflac policy. It's a lot higher payout. They're no longer going to payroll deduct the old one, so you'll need to come see me. It takes just a couple minutes to switch over. Price difference can be anywhere from $35 or 35 cents a month for family coverage to, I think it's $1.09 on an individual coverage. So not much different, but the payout is a lot higher. Two major benefits are the organized sports for kiddos. They pay 25% higher. And then family support. So if your child gets hurt and you have to get a room or take them to McDonald's, there's a $20 per day support fee. We will have a follow-up day. If you can't meet with me today, Stacy's going to send out an email when we will be back, and you can get with us then as well.
Real quick, I'm going to remind everyone on how to sign up for your benefits. We will be using the portal through My OTC. Does everyone remember how to log into their portal? Okay. Let me just bring it up really quick. One thing I'd like to note, the portal will open at noon today and will stay open till November 20th at 5 p.m. So all changes have to be made during that time frame. It will close at 5 p.m. on the 20th and will not open again unless you have a life-changing event. So just click on the 2016 benefit enrollment link. Here at the top, there is a link to directions in case you have questions. You can just click on there to download some directions. Here at the top, it will list everything that you currently have. So your medical, your dental, your basic life, supplemental life. Those of you who do not currently have supplemental life will not have supplemental life showing in the portal. If you're interested in supplemental life, of course, you'll have to go through underwriting. You will need to see HR to fill out paperwork. You go down towards the bottom. You can make no changes, or you can remove your signature. I've already been in mine, so I'll have to remove my signature to make changes. You can go in the portal and change 2 or 3 different times. Just know that each time you make a change, you will have to re-sign your form. If you do not sign your form, it will not submit any changes. Do you have any questions? It does show what you have elected last year. All of your stuff is there. Do know on flexible spending, please enter in the payroll amount, not your yearly amount, the payroll amount in whole dollars. So if you put in $2,550, do you really want us to deduct $2,550 a month? So just whole dollars, payroll amount. Any other questions? If you have questions, you can contact HR. We're available. We do have a couple of computers that we can log you into to do any benefit changes. I'll turn it back over to Tim.
Okay, 2 minutes and you're out of here. Real quick. When does open enrollment start? Excellent. When does it end? 20th. You're good, you're good. Okay, real quick, another thing is you can opt out. If you have a better opportunity in another place, you're on a spouse's insurance, or you're on a governmental plan that's just phenomenal, you can opt out, come to HR, fill out the paperwork, and you're good to go. If you fail to get in there by the 20th, you leave us no choice but to default you to what you had before. Now keep in mind, defaulting you, we can't default your flex plan. You have to do that every year. So you automatically be kicked out of there. Don't do it, because there'll be something that you probably missed that you want to change. So get in there by the 20th, get it done. That way you have what you need to have done. Also keep in mind, I think this is a really rich plan. Okay, I haven't been around everywhere, but I've been around, and it's a good plan. But to keep it a good plan, we all need to have some skin in the game. So next year, I'm telling you right now, next year there's going to be some changes as far as things that we have to do to keep it good like this. And what that means is tobacco cessation plans, anyone who smokes is going to pay a higher premium, and HRAs, health risk assessments, where they draw your blood, and you get a letter in the mail that says, hey, this is what we've identified. Whether or not you want to do something about it or not, it's your choice. This isn't guaranteed, this isn't cut in stone, but I'm telling you, with us being able to try to keep it where it is and keep it a rich plan, a good plan for all of you, we need to do some necessary steps to promote wellness around here. Because the more well you are, the more well I am, the better our rates will be. and we're all in it together. The higher the rates go, the college can't continue to pay it all for us. Eventually, we're all going to have to put more money into it. So we're going to be proactive, progressive. That's what all the top employers are doing. Ask your friends, what are they doing, et cetera. We're behind the game, in my mind. So look for those changes. If you're involved, if you want to get involved, get on the large insurance committee, small insurance committee, whatever. We'll figure it out together, but I can tell you now, next year it'll be a little bit different in order to keep this plan as great as it is. Okay, that's not a threat, just letting you know changes are going to come. All right, if you have any questions, stay back. Remember, you have subject matter experts in the back. Thank you. Have a great night.